Hello everyone and welcome back. We're going to do another how-to video, some shortcuts on how to do your discharge quickly and efficiently for your patient. So we want to provide the best discharge information for our patient. So the best place to do this is in the discharge workflow. It's where we can communicate with each other. So if you are a consultant and you want to have this patient come to see you, you can certainly put in your referrals in the discharge referral workflow. If you know you want your patient to have certain labs, at any point you can enter those labs into the discharge lab and tests section. So we're going to go over each one by one. Where would you like your patient to go, first of all? So your patient's going to go home, or they're going to transfer out to a skilled nursing facility, whatever your choice. So whatever your choice is here, you would make that. The next step would be the discharge medications. This is one of the most important steps in the discharge workflow. It communicates directly to your patient what you would like them to take when they're going home. So this patient was on several different medications at home, and it also lists their inpatient medications. So say you put them on something new while they were here in the hospital, or maybe change this dose of valsartan from one to another. Then you really do need to communicate that clearly to your patient. So you start with the home meds, and you as the providers are doing the reconciliation for these medications. So you're going to reconcile the home medication to the current inpatient medications, and then also with whatever medications you want to add. So let's say I want my patient to go back home on all of these medications. So I can click this continue button at the top, and I can highlight all of these medications. But I don't really want them on this dose of valsartan, so I'm going to stop that dose. And then I'm going to go down here and I'm going to take a look at this valsartan dose. Okay, it's the same thing, but maybe I put, once a day instead of twice a day. So then I can convert this medication into a new prescription for that patient. Also, let's say my patient's not on Colace at home, but I want them to go home and I want them to take this Colace when they get there. So I can convert this Colace into a prescription. I do need to put a quantity down, so we'll say 30 days. Say this patient, maybe you don't want them to take them every 12 hours. You could certainly back that off and change that to daily. So you're writing your prescription at this point, and you're telling the pharmacist exactly what you want your patient to have. So we're going to save that. And let's say your patient says, oh, wow, I have lorazepam at home, but my prescription's out. Can you renew it for me? Here's your renew button, so we can renew that prescription of Ativan should you so choose. And then in this workflow, you can also dictate how many Ativans you would like them to have. Maybe you'd only want to renew it for maybe 7 tablets, since they're maybe only taking it daily now. And then they can follow up with their primary physician, or you, if you are that person, once they get home and once they can make a follow-up appointment. So we have those medications addressed. Let's just say we want to add something new. So I not only want my patient on valsartan, but I'd like them on, say they're not on another medication for their blood pressure. So I'm going to add an atenolol. I will need to put a quantity, and I will need to leave that as a new prescription. Okay, so this is actually creating a prescription for that patient. You may get a mention of whether or not that patient has had renal function testing within the last 24 hours with regard to that medication. So here's where you're telling the computer where you would like these prescriptions to go. This action column will automatically default to transmit, but you can change it if you want to print this medication, so you can print it. Let's just say you'd like to go to the patient's, the computer near the patient's room, or you'd like it to go to a printer near you so you can actually pick it up and hand it to the patient. So wherever you'd like that printout to go, hopefully you're transmitting since this person has a preferred pharmacy listed. If you are not, let's just say this patient has Colace at home, they don't really need a prescription for it, but you want it to be on their discharge workflow, then you could select none. Again, also, if you're changing a dose of a medication, the patient already has it at home, you can also select none there as well. So that's going to file the medications. The next is your labs. So labs and referrals are technically in the same area. You can sort by category, either labs, tests, or referrals, and choose whatever testing you would like. You will have to select a service date, so how soon you would like that patient to have that testing, and also select a diagnosis. So their problem list should be populated here. Select a diagnosis associated with that test that you've ordered for your patient. If you go back to category, you can select referral. So let's just say you would like your patient to follow up with this particular group. And then you will need to select a diagnosis for that referral, and then how soon you would like that referral to happen. All right, so we've populated a lab and a referral, and we're going to save that, and that is going to populate to our discharge workflow. So again, if you are a consultant and you know you want that patient to have that CAT scan of the belly in a month's time, anytime during the patient hospitalization, you can go into here and order that, and it will populate to the patient's discharge, so that when the attending comes in and is doing their discharge workflow, it makes it that much easier to see that information. During our flu vaccination time, we will have to fill in whether or not the patient has been vaccinated for the flu. So you will have to answer that question. The next thing we're going to do is our discharge template. This is an actual physician document, or provider document. So you have your discharge comprehensive for your patients going home, your patient transfer form for patients going out to a skilled nursing facility. This Discharge General tab, this PDoc is reserved for use in the rehab hospital, so it is not used over here at the main hospital. In the Discharge General template, you will have an opportunity to select whatever you would like the patient to continue with activity or diet or weight bearing, their ADLs, and also you have open text boxes to write any additional instructions. So, you know, this is a place where you can put wound care instruction. You can also add any other text documentation. So there are CHF stroke discharge instructions. There's a few other things that you could add. So you do have the option to add additional text, which would go along with what is already populated: smoking cessation information, suicide prevention, stroke, heart attack. Several other things are already populated in their discharge instructions. Again, you would have to select whether or not, or select a patient problem. When we have our upgrade in September, this patient has advanced directive question will be automatically populated to this template. So you should not have to answer that question, but just to note that it will be there with the upgrade in September. Your goal for the primary problem will have to be filled out, as well as whether or not the person was affected by a core measure, VTE, AMI, CHF, and the like. If your patient was here for CHF, there are additional data points that they would like, that need to be filled out for your patient, so that we're collecting the appropriate information. And then also tobacco cessation. So this should automatically populate whether or not the patient is a smoker. So you should not have to answer that question, but just note that it is there. So you'll save this document. This is actually a PDoc, so we will have to sign it. If you've entered it on the wrong patient, of course you can cancel it, but here's where you would sign and pin your document. And you are one step away from discharging your patient. This is where you're going to put in your patient order, whether or not the patient is being discharged. And within this discharge order, you can also put in a contingency. So say you would like urology to see this patient prior to discharge. So you can put those instructions in there, and that notifies the nursing staff that yes, this patient is discharged, but urology needs to come see them first. Okay, so all your information is filled out. Your medication information is there, your labs, your referrals. You do have the option to enter any care notes. So let's just say your patient needs low back pain instructions, or maybe a high fiber diet or low fiber diet. So we can add that information to your patient's discharge instructions. And you'll see nursing use this because they can add care notes to the patient instructions and they'll print out. So that's additional information for your patient. The final step, this little finalize button at the bottom, this tells the prescriptions where to go. It also sends your electronic transmitted prescriptions to the pharmacy, or it sends the prescriptions to the printer. This is especially important for you to hit this finalize button if you are ordering a narcotic at discharge, because you will have to sign those prior to the patient being able to receive them. So we are going to hit this finalize button. Once we finalize these, the orders, the nurse taking care of the patient is able to print that discharge packet and discharge the patient. So unless this finalized word is next to your medications, you will not be the nurse taking care of the patient will not be able to print that packet and safely discharge your patient with the appropriate information. Please don't hesitate to call the helpline with any questions or concerns with the discharge workflow, and thank you for your attention.